February 12th, 2026. We are live streaming from Deuk Spine Institute surgery. Our patient travels from Pittsburgh, and he actually already had his SI joint treated on both sides. His piriformis muscle was released, and his facets were treated. We did that 2 days ago. He had such a great result from that procedure. We also told him he needed to have the L4-5 disc fixed with the laser, but he didn't want to do it. So he's back here today to have the L4-5 disc fixed. He's so happy with the other treatment. He wants to get the one last piece of pain he's got right above his fusion fixed, and that's coming from annular inflammation happening inside a damaged disc above the fusion. Now, folks, you can see on the x-ray, right, Anthony? Are you showing the x-ray?
Yes, I am.
All right. Can you see the white arrow?
Yes, I can.
All right. Yeah. And that white arrow is showing you screws in L4-L5 and then screws in S1. There's two on each level, one on the left, one on the right. Then you got a rod connecting the screws together. You've got a cage located between the bones. So this patient had a fusion done, L5-S1, started developing adjacent segment disease, or ASD, very common, and he had pain not only in his disc above the fusion, are we okay? But he also has pain in his SI joints, which we fixed 2 days ago, and the piriformis muscle and the facet joints. So all we've got left is the disc to fix. So here we go. If you have questions, please feel free to ask, but it's very common for patients with back pain to have more than one cause. And in his case, he had his two facets, his two SI joints, his piriformis, that's 5, and now his disc. So that's really 6 causes. He has 6 causes of back pain. Thank you. So basically, most patients have more than one cause of chronic back pain. As a matter of fact, there are 30 specific causes of back pain. And Anthony, would you mind sharing with our audience the 30 common causes of chronic back pain? Sean?
I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us.
Specific causes of chronic back pain. We've been able to identify all 30 at Deuk Spine Institute, and we offer a free MRI review for patients who want to do a virtual consultation or in-office consultation. We can diagnose your cause of back pain, and more importantly, we can treat it and get rid of the pain. Our patient is asleep. We're getting ready to finish our discogram. Are you having any back pain?
Any pain right now? Yeah, he is.
How bad is that pain on a scale of 1 to 10?
You picked up a little bit. What number did you say? 6.
Is that where you get your back pain?
Yes.
Thank God. All right. So we figured out where his back pain is coming from. A tear. Look at the size of that tear, folks. That tear is huge. Jordan, can you show us that tear? So I want you to look at the dye first in the middle of the disc. It looks like a hamburger. That is perfectly normal. That's where you expect to see dye. But look at all the dye leaking out through this gigantic tear above his fusion. That tear is the cause of his back pain. That's what I discovered here at Deuk Spine Institute 20 years ago. And now that I know the tear is the cause of the back pain, I'm able to fix it with a laser. We're the only place in the world that does this surgery, that repairs the annular tear with a laser. Since we pioneered it, it is our procedure here at Deuk Spine called the Deuk laser disc repair. That's why this patient came here to get rid of his back pain. Now, we already fixed his SI joints, and we fixed his piriformis, we fixed his facets, but he still had disc pain, and he wanted it fixed. I told him to fix it during the first surgery, but he didn't want to. And that's okay. Patients get to choose what treatments they ultimately get. After all, it's their body, their choice. All we can do as doctors is diagnose and advise. So he has a pretty deep back, but we're getting there. We're just about at the annular tear right now. You can see the tip of the dilator. Go ahead and show them the tip of the dilator. There you go. And I'm advancing it very carefully, very slowly, right past the hardware in the back. You guys see the screws and rods. We did not put that hardware in there. He came to us with a fusion, and now he's having problems from the fusion. So he has what's called adjacent segment disease. Pretty much everybody that has a spinal fusion is going to have problems above or below the fusion. He had both above and below. So if he hadn't had his fusion, I don't think he would have any of these problems. Yeah, that's definitely a painful disc. Before we show you another video on how the annular tear causes so much back pain, we'll take a few questions.
We have a question from a YouTube user. Are those the things you use to fix your spine in place? I
Yes.
don't think they are the same.
Okay, so when we do it, let me see a shot. We always mention the name of the person asking the question. So it'd be whatever their name.
The name itself is hard to pronounce, so.
Okay, fine. So one of our viewers from YouTube is asking if those are the things that hold the spine in place. The answer is yes. Those are screws and rods and cages. I did not put them there. They were put there by another surgeon. We don't recommend that type of surgery anymore. That's an old way of doing treatments for the back, and I don't recommend fusion anymore to my patients. I recommend laser. Much better procedure. Next question.
Coming from Ashley, is this protrusion the same as herniated disc?
Great question, Ashley. The answer is yes. All of these disc anomalies begin with a herniation. And unfortunately, our medical field has created so many different names for the same thing. They are all disc herniations. But if it's a small one, they call it a disc bulge. If it's a larger, they can call it a protrusion or extrusion or rupture or slip disc. So there's so many different names for the same thing. It's created a lot of confusion, unfortunately. But in the end, it's a very simple process. There's a tear in the back of the disc, and the jelly from the center squeezes out into the tear and causes inflammation and pain. We're going to show you a video right now how a herniated disc or injured disc causes back pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
You see from our animation that the way people get back pain from a disc injury, which is by far the most common cause of chronic back pain, 85% of people with back pain, it's coming from a disc injury, just like this one. 85%. And the way it happens is you get trauma to your spine. Basically, you get into an accident, like a motor vehicle accident, where you get rear-ended or T-boned. You can slip and fall on a surface and hurt your back, or you get into a sports injury. Those are the most common causes of injuring your disc. Once the disc is injured, it doesn't always cause back pain right away. It can take years for the back pain to develop. And the reason for that is back pain really comes from inflammation within the posterior annular tear. And the only way to get inflammation in that tear is to have what's called a herniation. So you may get initial herniation right away that doesn't hurt because you don't have much inflammation going on. So what happens when you get chronic inflammation from the tear and the herniation is you get an ingrowth into that area of little nerve fibers that are pain fibers. This has been well established. This is not something that I've discovered. Doctors way before me discovered that chronic inflammation brings with it ingrowth of new blood vessels and new nerve fibers. And the nerve fibers are always pain fibers. They cause pain. So think about that. That inflammation going on for years and years and years in the back of the disc on the tear caused by the herniation, and then the inflammation itself brings with it lots of little pain fibers that are very sensitive to pressure, so that when you stand up and put some pressure on your disc, it causes those pain fibers to be aggravated, and they send pain signals up to your brain. So any kind of movement of your lower back causes pressurization of the disc, which then causes aggravation of the pain fibers. That's what this surgery does. It's the first surgery in the world to directly address the pain fibers that have grown into the back of the disc, the annulus, with a laser. Laser is the best way to get rid of them. That's what I'm doing right now. I'm removing the pain fibers. I'm removing the inflammatory tissue. There's a little calcium there from chronic inflammation. I'm removing that. I'm removing the fragments of disc herniation that are stuck in here. They're a bluish color usually. So all that's being cleaned up with a laser. It's really basically just taking a completely abnormal area, vaporizing all the bad tissue so that the body can reheal it properly. All right, let's show the audience, before we take any questions, how the Deuk laser disc repair does all of those things we just talked about.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Dilator to get down to the herniation. It's a metal stick with a tapered tip. It spreads the muscles and soft tissues apart so we can get down here using a tube. And the tube itself is 7 millimeters wide, 1/4 inch. So we're not making a very big passage, we're making a very narrow passage. This is what's called ultra minimally invasive spine surgery. The other doctors that say they do ultra minimally invasive are actually not doing ultra minimally invasive, because this is the most ultra minimally invasive treatment, and they don't do this surgery. They use larger tubes. So it's funny how they promote their techniques as being ultra minimally invasive, yet they're actually using larger tubes than I use. So we have the true ultra minimally invasive treatment. All right, we'll take some questions.
I have a question from Ab Diaz on YouTube. Sir, last time you were in live, you asked me where I'm going doing my neurosurgery residency. I'm doing in Turkey, but originally I'm from Somalia. I really like you, and I wish I will be your first fellow.
Oh, thank you so much.
I wish
Thanks.
you more research, sir. If you allow me, I'm able to collaborate. Thank you for invitation.
Well, first of all, thank you very much for being here and commenting and sharing your experience. I wish you success in your career. Whatever you decide to do ultimately in neurosurgery, it's a great career. You'll be helping a lot of people. As far as collaborating, I appreciate that. There may be an opportunity in the future. We're just not set up right now to accept any type of student to come over and collaborate. So I would love to get a copy of your CV. If you have any research that you've done, any publications, I would like to see them. That would be wonderful. I'm not sure how to get that to us, but you can mail it to our office. Attention, Dr. Ara Deukmedjian, and I'll be happy to look at your CV. So please send us your CV. All right, any other questions?
No current questions.
Okay. He's perfect. I just need a couple of minutes. We're almost done. Folks, we're almost done. We are in the herniation right now. This is herniation here. You can see the gold color is calcium. When the laser energy interacts with the calcium from the chronic inflammation that's located inside this annular tear and herniation, it turns a gold color. You guys see that? So we call this calcium dystrophic calcification. That is the pathological term for it. It is found in abnormal chronic inflamed tissues. It's been well known, well established by pathologists for many, many hundreds of years, using a microscopes to find it. But it's just an indication of how long this problem has been going on. It's kind of like if you scuba dive and you come across a shipwreck and you're looking at the ship underwater and you see lots of rust. That rust means the shipwreck has been there for a long time. But if there is no rust at all, then the shipwreck just happened recently, right? If it's a new ship and the paint is still there and there's no rust on the hull or any of the metal parts. So rust is an indication of oxidation of metal, but it takes time for oxidation to occur, and it takes the right conditions, salt and water. Long story short, oxidation of metal takes a long time, so does the formation of these calcium deposits in this tissue. They are not normally found here, just like rust is not supposed to be found on a normal ship hull. But when it's underwater for many years, you're going to start seeing rust deposits forming. These calcium deposits are like iron deposits that are oxidized iron rust on a ship hull. All right, we're just about done. We need 1 minute more. This is the last bit of the annular tear and herniation right here. You can see how well the laser works. For those of you who don't know, the laser fiber there is 1 millimeter wide. So what you're seeing is a 1 millimeter wide fiber. That's how precise this surgery is. Very, very precise. All right, Anthony, any other questions?
We have one question from Doc. What all surgeries does the hospital do?
I'm so sorry. Can you enunciate more clearly and maybe speak a little closer to the mic?
This question comes from Doc. What all surgeries does the hospital do?
Yeah, so I'm a neurosurgeon, trained to do any type of neurosurgery, but my focus is spine surgery. And we have been doing everything from laminectomy, discectomies years ago. We don't do them anymore because we don't like doing them. They're not necessary, and they harm the patients. We've done fusions, lumbar fusion, T-lift, cervical ACDF, PCDFs. As a matter of fact, we have a very complex PCDF coming up in a few weeks. The patient has... Next Thursday. The patient had a surgeon who did a prior cervical laminectomy, did not fuse the patient. He ended up developing chin-on-chest deformity. So I'm going to be doing a posterior cervical laminectomy with what are called osteotomies. I'm going to remove the arthritic facets, try to correct his alignment, and then I'll do instrumented fusion from C3 down to T3. This patient is in really bad shape. His head is facing down at his feet all the time. and we're just getting cardiac clearance. The surgery will take me 2.5 to 3 hours. That will be a long surgery. All right, we're done. But we can do any type of spine surgery here. Any other questions?
No current questions.
All right, let me show you folks the incision. It's tiny. Our incision is just 7 millimeters, 1/4 inch. And this patient's going to go home in 30 minutes. It's outpatient surgery. You can see the tube, and I'll show you the incision. Blood pressure's good. We're going to put a couple of staples in the incision. You guys see the incision here?
Yes, we do.
Right here.
Yes, we do.
Very tiny, tiny, tiny. Endoscopic incision. This is true ultra minimally invasive spine surgery. And we've been doing it here at Deuk Spine for 20 years, while everybody else was still doing laminectomies and discectomies and destroying the normal architecture anatomy of the spine through their surgical procedures. We have been revolutionizing spine surgery for 20 years here at Deuk Spine Institute. We've completed our 2,744. Henry, is that correct? Deuk laser disc repair?
2,744, correct.
This is our 2,744 laser endoscopic surgery. 0 surgical complications in 2,744 surgeries. Thanks for joining us. We'll be back next week. Enjoy the rest of your week, folks.
I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I have a patient with me who just had the Deuk laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year, I'd say close to 5 or 6 months. It's one day after and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Deuk Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
You had, was it back and leg pain, correct?
back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5-S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4 inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a microdiscectomy or laminectomy, which is what every other surgeon offers, because they don't know how to do the endoscopic surgery, it's a newer technology, then you would have had a bigger incision, you'd be in a lot more pain today, and you'd have bone and ligaments taken out of your back. It would weaken your spine, which would set you up for fusion. But with our surgery, there is no need for any future treatment on the disc. It's permanently fixed. Now, are you taking any pain meds today?
I haven't yet today, and I haven't felt the need to, which was another surprise I had too.
Yeah,
So
no pain meds, right?
Nothing.
No bleeding, no hospital, no pain meds.
Nope, in and out pretty quick. It worked out pretty well.
Pretty happy?
I am.
And you were referred through Coral, right?
Correct,
Coral
correct.
Network.
Coral Network.
What do you have to say to the Coral people who approved your surgery?
I just appreciate the approval and the opportunity to live like normal and be a normal human again.
Yeah, Coral did you well. I guess they somehow got you to us and you avoided having an invasive surgery that was going to hurt you more than help you.
Correct.
Congratulations.
Yeah, well, thank you, Doc.
Anything else you want to say to your fans out there in YouTube land?
I would just encourage you to look into Deuk Spinal and figure it out if that's the right fit for you, and it was for me, absolutely. So, thank you.
You're welcome, my friend.
Appreciate it.
Congratulations.
Take
Take care.
You too.